I questioned why some of us have that cancer cells that activate and become tumors and invade our bodies. Okay. I remember when I was presented with the fact, yes, you have this thing inside your body. The first question I asked myself was, what did I miss? What I mean by that is, I've been working on myself for a few years at that time. And I was not really scared when they said that diagnosis, but inside of me, because I was doing this work, so I kind of felt a little bit into shame because I'm like, how in the world I'm doing this work and here I have this freaking cancer diagnosis. That part I could not really sit well because I knew that, okay, I missed something from the past. That's my belief, strong till today. I must have missed something from my past in terms of the hurt, the pain, the frustration, unhealed trauma, which I had a pretty big bouquet of those, that I did not connect that I still have some pain inside of me. And what I knew at that time was that if some sort of trauma, and if you someone who believes, strongly believes that, oh, I don't have any trauma in my life, I'm not talking about the huge traumas like molestations, assaults, or kidnapping, or something bad happening, death, divorces, and stuff. You don't need to have those big things in your life. If you have those, I want you to make sure to heal them, okay? So it could have been my mom yelled at me. And as a child, I created this belief about me that she doesn't love me, or my dad doesn't love me, or whatever is going on. Because as children, we cannot process things the way we do as adults. Okay. So I had to go back in time and say, okay, what did I miss? What in the world I missed that it was not processed at the emotional and mental level, that my body kind of, okay, so let me back up for a second. If we don't process things at the emotional, mental level, those emotions don't go anywhere. So what happens is basically something comes up. We have a strong emotional reaction and we don't process. Let's say as children, we don't know how to, right? So what happens to those emotions is we push them down. They get stuck in our body. They get pushed down. So that doesn't not only affect, let's say, breasts for women with breast cancer, but it also affects any like ovaries, any what's the word I'm looking for? Female productive organ system, right? So any kind of organ can be can develop a cancer basically, or any kind of disease. So it doesn't have to be just breast cancer or any female productive organs. It could be anywhere technically. But we push down these emotions, and if you have more events happening in your life, if you do not process emotions, something happen and someone may be angry, for example. What we do is we push them down, we push them down, we push them down until your body is not able to handle that emotional charge anymore. So then it becomes a disease. Then it gets activated in your body because whenever you feel something in your body, whenever you feel it pain, whenever the disease comes, whenever you get sick, your body says, I cannot handle anymore. Pay attention to me. Okay. So that's what usually happens with cancer as well. And look, I want to make a disclaimer right here, right now. I'm not a counselor, I'm not a medical doctor, I'm not any of these things, okay? But the reason I'm speaking here today is because I speak from experience. And I helped hundreds of people heal themselves. And I put myself basically on feet. I can share in a probably different video where I could not even sit because of the excruciating pain. And today I wear heels and dance and do whatever, right? And I never had surgery. So I'll share that later. But I'm sharing all this from my own experience so you can also take care of your body, take care of your health, and not necessarily jump into the surgery unless you really have to, unless it needs to be happen, right? But you can prevent this. Even if you don't have cancer right now, if you don't have this disease or any other disease right now, I want you to look at a different angle. I want you to look at the past hurts. That's what I found. Okay. I knew for many, many years that something happened that I did not really like one person in my life, but I could not put my finger on why exactly I did not like that person, or I could not make a connection, and it was a family member. And after my diagnosis, when I started digging deeper and I'm peeling those layers, I suddenly connected the dots. I'm like, okay, so this is called molestation. And as children, we do not connect the dots, okay? We think, oh, this is normal, this is okay. But what happens usually, if you had this experience, I can bet that in life, 90% of people, of women, for example, they will have some sort of assaults happening as well. That's what happened to myself. So it could be vice versa. If you had an assault or anything sexual during your life happening, it's likely, and I'm speaking again from experience and the knowledge that I have, that you may have had some inappropriate behavior towards you happening early in your childhood. So not saying 100%, but this is a likelihood, okay? So whenever I connected the dots for myself, that this is what I missed myself, I shut the door for the weekend. I canceled all my plans. And some people got pissed because I did not explain, look, this is a little personal, so I don't have to explain to anyone why I'm shutting the door and I need to heal. My hair somehow just, anyways. But I shut the door and I did what I had to do. I had to heal myself. I had to heal that part of me that was still hurting, that was still angry, that was still in pain, that was still traumatized. And my body just simply, with this cancer thing, it just said, look, take care of some part of you that is still in pain. So I want you to invite to look at your life, and I'm going to give you some symptoms, what to look for in terms of identifying, okay, do I have anything in my life that I'm still holding on to, okay? So any hurt, any pain, any frustration, for example, that you have towards someone or certain circumstance or situations. Now, you may feel those feelings. You may not remember what exactly happened necessarily. Some people remember, some people have memories, some people don't have memories. What happened, let's say for me, I had a memory, but my mind was doing such a brilliant job protecting me that it did not allow me to connect the dots at the time or when I was going through a different part of healing for myself. But eventually, look, I'm like, you gotta let me in. So I want to take care of that. Okay. So look for any kind of traumatic experience. Look for the frustrations right now in your life. If you have people in your life that you feel something is off, but I can't really put a finger on what exactly is going on, pay attention. Try to look deeper. Forget what you know about that person and just allow your heart to lead you where it needs to go, okay? Don't trust your mind. Don't trust your thoughts, especially if they say you did something wrong. It's your fault. You did something that caused something else, okay? Because usually what's going to happen if you have a memory, let's say, if you have a clear memory of certain thing and it still kind of causes you to feel that ickiness inside of you, please pay attention, because that might be the cause or that might be part of the cause, okay? So this whole spiel is more about identify the actual root cause of your disease, of the cancer or whatever else is going on in your life. Because usually that's a stored memory, usually that's a stored pain in your body that you need to heal and release. Okay, so past hurt, trauma, unresolved issues may or may not remember the actual events or what happened. So if you do remember, it's pretty easy to neutralize, sit with emotion, process things, understand what was really going on, why things were going on, create alternative explanations, even if they don't make sense to you. Okay, so basically, we're neutralizing those memories. So there's no emotional charge that still goes back and forth, and affects us every day in your life. Okay, by the way, a couple months ago, I published my book, The Journey to Healing. If you cannot really, it's like, Renata, I have no idea what you're talking about here, root causes and stuff. I teach how to actually get to the root cause, like step by step, what questions to ask yourself if you don't have help next to you for that. So feel free to grab a copy or book. It's called The Journey to Healing. Just put my name and it's gonna pop up. But anyways, you have that tool, okay? And if you have Kindle on Amazon, it's even free. So yeah, that. Now, I have a couple symptoms written down just so you have a better chance of identifying things, okay? So let's see. First of all, don't be judgmental towards yourself or angry with yourself if you don't recognize them right away. Now, I know there will be those people who are watching this video and they're like, what kind of BS you're talking about? How can my past, how can my hurt is actually impacting my health? Well, you don't need to believe me. If you want to go the traditional route and choose the medical doctor's advice, what they want to tell you and what they want you like to push you towards whatever programs are, look, who am I to say or judge you for that? Make your own choice, make your own decision, okay? But if you're willing to look at a different angle and actually heal yourself, I will share what you need to look out for. Now, one thing before I go there, even if you have a surgery, even if you have radiation, even if you have any other treatment like chemo and stuff, if you do not address the root cause, what actually caused that cancer to get activated, I can almost bet that you can take everything out of your body. Some women even do mastectomy, which my heart goes to you guys. Really. That cancer, if it's still not resolved, it will appear in a different part of the body. I promise you that. It will come back in a different form. Maybe it's going to be a different disease, but that emotional knot, that emotional pain is still there. So what you're doing, whenever you, let's say, eliminating the pain surgically, and look, sometimes we need to do, I've done that pain, but then I took care of the cause, okay? If you're eliminating surgically pain by eliminating a part of your body, per se, that pain doesn't go away anywhere. It stays, it's just, you're numbing it down, you're pushing it still down, and it's gonna move sooner or later to a different part of the body. And there is a different reason for secondary cancers. When I was looking into the science and how much, let's say, radiation goes into lungs and stuff, there is a great chance 7 to 10 years after radiation for secondary cancer to develop. But also, I believe that there is a secondary reason. If we do not treat that pain, if we do not address what's actually caused that disease to be present, that we gonna develop that cancer. Now, I have not done, like I mentioned, radiation. I have not done chemo. I have not done any other treatments, hormonal or whatever that was suggested. I'm still alive. I'm fine. Not a single cell reactivated. I'm still here. So let me go back to what to look for, okay? And now I'm gonna talk to you who wants, if you want to actually look at that alternative angle, to find that root cause, to find that pain, okay? So look for any frustration. Look when you get mad, especially if that is a pattern for you. Mad, frustrated, angry. These three things are the best guides if you ever feel that. Now, you can also flip onto the other side where you please people, where you're really nice to everyone, when you're doing such a great job and do your best to feel the best you can in front of others, to say the best word you can, to think the best thought you can, to do this good deed. This is a lot. I see a lot of people in nonprofits where they try to raise funds, help others, because there is a part of them that's still hurting. So oftentimes, I'm not saying 100%, but oftentimes I see them compensating with good work because some part of them is still hurting and not healed. Okay, so look at the contrast, look at the frustrations, what troubles you, what bothers you, and look also where you take an extra step to be good to the world, to show up as a really, really good person. Okay, because these two sometimes can give you a different message. Okay, now I want you to pay a special attention when you're behind the closed doors, when you're by yourself with yourself in your own mind. How do you speak to yourself? What do you say to yourself? Grab a journal. I mean, start making a note. If you're not someone who's journaling, you don't need to write stories. Just make a note. What specific words did you think? What are the patterns of you keep thinking? If you keep getting bothered by other people saying a word to you that you did not like, or there is something about other people that bothers you all the time, and you keep in your own heart and you keep hurting because of that, or you keep saying yes to everything everyone asks. So if someone asks you to help, you always say yes. You never say no. So pay attention to these things, because then you can question yourself. Why am I doing this? What's behind my yes? Why am I afraid to say yes or no? You get my point where I'm going with this? Because if you're constantly saying yes, you're saying no to you. That says you're showing love towards others. But my question to you is, where's your love for yourself? So part of you might be hurting because you don't feel love for yourself. So you're compensating with love towards others. But at the same time, you're hurting yourself more even every single time. Okay, make sense? If you have questions as I'm speaking, just drop them down whatever you're watching these, okay? I'm looking what else look at the relationships you have, especially with your parents, siblings. Oftentimes we feel that if it's blood relationship, we have to hold on to that tightly. And that's not always the case. Blood does not mean that we're tied for life with that person. Look for where you hang on into relationships, no matter how much they hurt you. So look for symptoms like, and I love calling them symptoms. Look for things where you say, oh, that's the person, that's all they do. They always do that way. That's just who they are. but deep down, you feel hurt, you feel pain, and you still choose to hang around those people. Okay? Look at your work environment. Maybe you have a job, maybe you have a business, and you dread getting up each day. You hate what you do, but yet you feel like, oh my gosh, I have to pay bills. I have to get up. I have to do this all the time. I have no choice. Okay? No choice. Pay attention to these two words, because every time you say, I have no choice, you're saying no to yourself. And I say you always have a choice, and you're choosing something over another thing. Okay? Sometimes it may feel we don't have a choice, yet we are choosing. And I want you to pay attention. Are you choosing because this is good for you, or this is good for someone else? Every time you say no to yourself, you're hurting yourself. You're saying, I don't love me. And I know it may sound cliche, but that love towards yourself so many times is like at the ground level when compared to other people. You carry them on a pedestal basically and say, oh my God, I love you so much. But yet when things turn around towards you, about you, you just treat yourself like crap. You talk to yourself like crap. And trust me, I'm not blaming. I'm not saying that's wrong. That's the best you know at this moment what to do. So I don't want you to blame yourself or pinpoint the bad. Oh my God, I'm so bad. I'm doing this and that. No. What I'm giving you is so you become aware. Because if there was probably a title for self-judgment or even pleasing others, I would probably get a pleasing queen or the self-judgment title of the queen, like queen of the self-judgment title. I've done this so much to myself. I did not even realize I was doing this. And the best, we oftentimes don't even know we do this. And the best way to identify this self-judgment is when we look at other people and we think, oh my God, I can't believe they did that. I can't believe they're wearing that. I can't believe this is happening and they're doing this, or they're behaving this way, they're saying this way. If you say these things, if you think these things, you're judging yourself 100 times more. Back to self-love, back to self-judgment, back to the same anger. You may push it down as many times as you want, but unless you find the root cause, unless you clean it all up, unless you neutralize the memories, what happens in your life, I mean, look, same cancer, other diseases. I really want you to look at a different angle, because you don't need to go through the stuff that you do, and you don't need to have repeated diagnosis. Yeah. And I hope this is helpful. If you're someone who actually really says, oh, this is bullcrap, why then you're watching till now? Why haven't you turned off this video? Why you're still here? There must be some part of you that cares about this. Forget what have you learned over the years, because as I was, let's say, growing up, I was taught to never feel, to never speak. And no one actually said don't feel, but every time you want to express your opinion or you hurting like a child, oh, get over it. If you hear that over and over again, you push it down. Do not play the guilt game, the blame game. We can say, oh, my mom made me this way. Oh, that person has treated me this way. Look, I'm not diminishing what has happened in your life, okay? I'm not saying what happened was okay. What I'm saying, it's time to heal and let go of things. You don't need to agree with what happened. You don't need to keep these people in your life if they're close family members or friends, but you need to heal yourself. You don't need to blame yourself, and I don't want you to blame yourself, because the moment you start blaming yourself, that's the self-judgment that keeps coming up. No guilt. Please don't guilt trip anyone, especially yourself, because that's another reason why we develop those diseases, why the same cancer comes up. Now, if you're someone who's watching this and you have someone else close to you going through the treatments or cancer itself, or have gone in the past through this, and you had a hard time supporting that person, comment below, and if there's enough interest, I may do another video about that, because I had to set really strong boundaries for my friends and family, because the moment a person, okay, so majority of people, right, whenever they hear a word, let's say cancer, what comes to their mind? Death. Real bad. Oh my gosh, what are we gonna do now? Basically, it's like, start digging the hole and put me down there and say goodbye right now. That's what majority of people have, how they perceive that disease. Because I've done tons and tons of work on myself, and I still do, and I probably will never ever stop, because look, we're not one day old. We had life experiences, we had stuff happening, we've seen stuff happening. So we created so many beliefs, so many perceptions, so many truths about ourselves, and we had emotional experiences in our life. So there is a lot to be undone, a lot of layers to peel, right? I will never stop healing, and I will never stop becoming more and more aware of myself. So look at your life, and I just lost my thought, what I wanted to say. No, seriously, I was going somewhere with this and I forgot. You know what? Screw that. Anyways, if you don't, oh, I remember setting boundaries. I had to set boundaries because of that perception. And I brought in really close people in, and I did not say them probably a few weeks after my diagnosis, because I knew how they would react, actually. And every time someone shows pity, and I'm not saying compassion, I'm saying pity, because of the fear, what that means to that person, what cancer, let's say, means to that person. They don't know what to say, what to do, how to behave around you, how to react, which words to say even. And then they start dragging you down. So if you need any help supporting others, just comment below, and whatever you're watching this, and I'll be happy to create another video to just give you some guidelines, what to do, what not to do, what may be helpful, what may not be helpful, what actually may flip that person into the victimhood, rather than, okay, this is what's going on, I need to take steps. It's not an easy journey for either of the parties. Actually, if you're supporting someone, you're probably having a much harder path mentally and emotionally than the person who's actually going through this. Because the person who's going, yes, they're dealing with stuff on the top of the physical symptoms and physical issues or treatment that they're going through. But because you don't have the power, in a sense, to help them, sometimes it can be much harder on you. So let me know if you want me to create a video, and I'll be happy to. Now, if you have any question whatsoever, whether what I was going through, why I made these decisions, or you need any help identifying the root causes, identifying whatever has happened in your life, just comment below. I'll share whatever I personally know, whatever I've observed. And just for the funds, like my daughter likes to say, there is a reason sometimes we go through these experiences, okay? Because about a year, I believe, or maybe a year and a half after my surgery, and after I've gone through the cancer experience, my client actually was diagnosed with breast cancer a month, no, 2 months after my surgery. My mom had a stage 3 breast cancer. You may say, Renata, look, genetics played into like, why don't you believe in genetics? Look, yes, genes can play some part of in this, but why not everyone who's in the family had cancer, then develop cancer in their own body? Why it's not 100% of the time then? I'm not denying that impact. I'm not denying that there may be something going on there. But why then medical field, the doctors, not a single doctor, and I've seen plenty during that experience, not a single doctor asked about my life. Not a single doctor even inquired, was there anything stressful in your life? Was there anything emotional that may have impacted or increased the chances for that to become active? I don't know. It might still be a mystery, but my strong belief is we bring a lot of stuff ourselves. If I know an answer to your question, I will respond. If I don't know, I will say, I don't know. But feel free to ask. Feel free to share your opinion, your experiences. There is no right or wrong way. If you feel better, if you go through treatments, go ahead, do that. If you want to follow doctors' prescriptions, go ahead, do that. Because if you go against yourself, what you feel is right for you, you will be questioning. You will be saying, what if? If you're in my shoes, let's say, and you say, oh, this chick is not, he has not done the radiation or chemo, she's fine. But deep down, you're going to feel fear. What if I have it come back to me? What if it spreads? What if something happens? That thought alone, that fear alone, will make you develop that cancer or spread it further. Look, I can't tell you what you need to do. I will never tell you what you need to do because it's not up to me. I have not lived your life. I don't know what your experiences were. Even if you tell me your whole life story, I did not feel the way you did in your life. Only you have this key to your answer. You need to go inside. You need to look within. You need to feel what's going on inside and make decision from that standpoint. If something does not feel right, run. I'll tell you, okay, so here's another thing why I made this decision not to do, let's say, radiation. I was at the radiation office. I had an appointment. I talked to the head of that department. That lady that actually kept reaching me, and I didn't want to talk to her because she felt I was like doing this stupid shit. They did all the measurements, they did all the scans. And you know what happened as I was laying on that table, as they were doing those measurements? I was dying inside. My whole body was screaming. I remember myself there and like, it's kind of, that's what I'm supposed to do, but my whole body is screaming. And I'm listening to those screams inside. I'm like, why am I doing this? I know this is the protocol that they need to follow. And look, I'm not blaming them, the doctors or whatever, that they just follow the protocol. That's what they know, what they need to do, the best they need to do. But I listened to the inside. I listened to my own heart. What my inner voice was saying, it was not for me. I know that majority of people don't agree with me, but I went with what felt right for me. That's what I want you to do. Go with what's right for you. That's all. Anyways, it's almost like 40 minutes. I did not mean for that video to be that long, but once again, if you have any questions, if I know, I will respond and share what I know, okay? If you need any help, just message me. I'm sure there's some contact information, whatever you're watching, or just direct message me. Cool? So I hope that is helpful at some level, at some point, for some people, for someone, at least one person watching this. I really hope. And I wanted to share this different angle because I don't see medical community even talking about this. So I hope you found it useful. Have an amazing day, amazing week whenever you're watching this. And I'll talk to you next time.